So
and around here it can be pretty treacherous. You never know if you can get from this area to Columbus, because who knows what the weather's going to be like.
So we went ahead and went that night and spent the night there.
So you went immediately. You didn't want you didn't want to take any chances.
No. And so we went ahead and we spent the night in a hotel, which pretty much I didn't sleep. and then I was there at 7 a.m. for registration, and they were just like, "You're walking in here, and you're going to be having a transplant." And I'm like, "Yeah." And so
that's unusual for them. Then
oh,
people
very
are
much.
usually
they're usually at when they. I'm sorry.
And yet, you know, I would think that it would be so much better that someone is on there. I mean, the chances of success are so much better if you are able to come in under your own power. So that's a wonderful thing that you're able to walk in under your own steam.
So then they prep you for surgery, and your surgeon has to make sure that the organ comes and everything's right, and then you go in for surgery. So I think that was around noon or something on Monday afternoon.
Let's go back to you, Cynthia.
Sure.
These are really remarkable stories, and I can easily see how we might actually end up with a third show on this because your stories are absolutely fascinating. Now, we left off with you. Where were you? You had just met the recipient, and it made you you had no doubts anyway, but it made you even sure that you were doing absolutely the right thing. Tell us a little bit about his story.
I don't know a whole lot about his story, and I really didn't get to know him very well, but he was on dialysis for 4.5 years and was very sick. I believe that he's also diabetic, in his mid-50s, and has a family, and had not been able to work for some time, so was really in great need.
And you mentioned that this was an incredibly emotional meeting. This was very emotional for his wife, it was emotional for him, it was emotional for you.
They gave me a little glass statue of an angel, and that just kind of like put me right over the edge.
And you met him the day before the surgery.
Right.
And this was in the afternoon that you met him?
Right.
So you met him, and it was a brief meeting. It wasn't prolonged. And we haven't talked much about, your family was pretty much behind you doing this. They were quite supportive, weren't they?
They were. They were. Although I have to say that I kind of said that I'm doing this, so I hope you'll hang with me. But I did. I had the support of my children and my husband, yes. And
how did you explain it to your children? How did they react?
Well, I wanted to make really sure that they understood that everything was going to be okay. Now, I don't have the power to make sure that everything was going to be okay, but I felt very confident, and I wanted to answer all their questions. And I talked to them about what was going to happen. I talked to them about what it was going to be like when they came to see me in the hospital. And I did neglect to tell my youngest that when she came to see me in the hospital that I wouldn't be leaving with her. So that was a little bit rough on her, because you can imagine that I knew I wouldn't be leaving yet for a few days, and I just didn't think about telling her that.
Right, because of course you know that, and it always reminds you of how you have to be very explicit with children.
Right, right.
Because
And I talked to my children. I asked them about, did they have any concerns? Did they have any fears? I really wanted to portray my confidence so that they would feel that, and I think that I did. I think that they felt as good as they could feel.
So you went back to your hospital room and you waited. The surgery was first thing the next morning.
Right. Well, I actually checked into a local motel, and then that the hospital owns, and then I was there first thing in the morning.
So the recipient was hospitalized. You were not hospitalized.
Well, I think he went home too, because he was closer to the transplant center.
Now, we should say the entire cost of this was borne by the recipient.
Correct, his insurance.
His insurance. And this was at absolutely no cost to you. And we should also say that there's never a cost to the donor. Whether the donor is deceased or alive, the donor never bears the cost. It's always the recipient.
That's correct. And there's even some funding for folks who might miss some work and not have paid leave. Some travel money if you're traveling to another destination, another location to do the transplant. I didn't need that. It was just in Charleston, West Virginia, and so that was close by, and I had paid leave. But no, there was no cost for me.
Yeah, and let's bring you right up to the time you come the next morning.
Right.
And they actually gave you the opportunity right up to the very last minute to change your mind, didn't they?
Right. In fact, they prepped me. They gave me an IV. I was all ready. And that the nurse said to me, now I'm going to give you something that's going to really put you out, and I have to ask you one more time before I do that if you're really sure that you want to do this. And I just said, yes, definitely. And so she gave me the juice, and she was right. I was gone after that.
Okay, so let's stop with you. And I can easily see how we will continue this in another show. But let's get both of you. We've got you about to go into surgery. Let's get you about to go into surgery. You are now, you went up to Columbus. Mm-hmm. You spent the night in Columbus. Yes. You showed up at the hospital in the morning.
Yes.
What happened?
I went to registration, got everything done, and then I went up to the ICU, got in my bed, and they prep you with different blood work, this and that, and they prep you for everything except going into surgery. And then when your organ arrives, the surgeon checks it and then says it's a go, and then they give you, as she said, the juice to put you to sleep. And I remember being wheeled down the hallway and everything.
Now, of course, you never, Cynthia met the family. Mm-hmm. You never met the donor family.
I have.
Okay, you have, but not at that point.
No, no.
Although you did know the story about what happened to the donor.
Yeah, I knew it was a car accident, and I knew it was a boy.
And you knew it was a boy, and you knew
he was 17.
So you knew the age, you knew the gender, and you knew the cause of death.
Yes.
But other than that, that's all you knew.
At that time, yes.
Now your family is waiting at the hospital. Now who came with you?
Both families, my mom and my dad's family. Everybody was there.
So everyone was there.
Yeah.
And for them, this is, I mean, this is really almost, it's a difficult occasion, but it's also a very joyous occasion.
Yes. Because that was my medicine. That was what I've been waiting for. That's what I needed.
Right. And did they talk to you beforehand? Did the nurses and doctors? I mean, did the surgeon come and talk to you? Was there what kind of communication did you get from the physicians and the nurses?
Well, I knew how the process was going to go. They kind of talked to you about that in the 2 days that you do the testing to get on the transplant list. So I pretty much knew that. And then also the surgeon that was on call, I had not met before, so he came and talked to me and stuff like that. So just being prepared for surgery.
But these were people you hadn't met. I mean, you clearly throughout your life had had a series of physicians.
Yes. Mm-hmm.
Jackie, can I say something?
Really quickly.
Okay. Well, when you said when the surgery was a go-ahead, that's wonderful. Sometimes it happens that it doesn't happen right away and things fall through, and I just wanted to mention that because the recipient of my kidney, there were 3 other donations he was supposed to receive prior to mine, and they fell through, and you can imagine the disappointment. I'm delighted for you that it went through the first time. And
thank you.
And we're gonna finish up your stories next week. We'll kind of do a recap, and then we're gonna finish up the stories. I want to thank our guests for sharing their experiences, and next week we're going to continue both their stories. For upcoming episodes, viewer feedback, and links to important information on health, log on to our website at the address that appears on your screen. Thanks for watching Health Vision, a production of WOUB Center for the Public Media.